Imagine your very first breath. The lights are too bright. Someone is wiping you down. You don't know your own name yet. You don't even know you have a body. But there's already a war happening inside you, and you're losing it. The doctor places you on your mother's chest. She's tired. She's also sick, but she didn't know it during the pregnancy. Nobody tested her. And so for 9 months, while your tiny heart was learning to beat and your fingers were learning to curl, a virus was crossing the placenta and moving into your blood, one cell at a time. It found your immune system before your immune system even finished building itself. That's the part that matters. You were born already infected. You don't feel anything at first. That's the trick. Most babies born with HIV look completely normal for the first few months. You cry, you feed, you sleep. Your mother counts your toes and falls in love with you. Nobody can tell. Not even the best doctor in the room can tell just by looking. Because the virus isn't attacking you yet, it's setting up. Let me explain what's actually happening inside you. HIV is a virus that hunts a very specific kind of white blood cell called a CD4 cell. Think of CD4 cells as the generals of your immune army. They don't fight infections directly. They tell the rest of the army what to do, where to go, who to attack. A healthy person has between 500 and 1,500 of these generals in every tiny drop of blood. You're a newborn, so yours are even higher. But HIV slips inside these generals, takes over their machinery, and uses them to make more copies of itself. Then it kills them and moves on. Every day, millions of your generals die, and the virus multiplies. Your army still has soldiers, but nobody is left to command them. You're 3 months old now. You're starting to smile. Your mother thinks you're the most beautiful thing in the world, but you've got a runny nose that won't go away. You had a little cough last week, then a rash, then thrush, which is white patches inside your mouth that look like spilled milk but don't wipe off. A healthy baby shouldn't have all of this stacking up, but you do, because your immune system is shrinking while the rest of you grows. Around month 4 or 5, things start getting harder. You're not gaining weight the way you should. You're skinnier than the other babies at the clinic. Your mother is worried. She feeds you, but the food doesn't seem to stick. This is one of the first big clues. Doctors call it failure to thrive. It just means your body is burning through everything it eats, because the virus is making your immune system fight all the time. And fighting takes calories, lots of them. By 6 months, if nobody has caught this yet, you're in serious trouble. Your CD4 count, the number of generals you have left, has dropped fast. In babies, it can collapse much faster than in adults. And here's the brutal part. You don't know any of this. You can't tell anyone your chest hurts. You can't say you feel tired. You just cry more, sleep less, breathe a little quicker. You become the baby who is always sick. Then comes the lungs. The most common killer of babies born with untreated HIV is something called pneumocystis pneumonia, or PCP. It's a fungus. In a normal person, your immune system swats it away like nothing. It's everywhere in the air. We all breathe it in. But in a baby with HIV, with no generals to command the fight, the fungus moves into the tiny air sacs in the lungs and just starts growing. It coats the inside of your lungs like a wet blanket. Air can't get through it. You're maybe 7, 8 months old when this hits. You start breathing fast, faster than you should. 60 breaths a minute instead of 30. Your nostrils flare with every breath. The skin between your ribs sucks in each time you inhale because you're working so hard to pull air through lungs that are filling up. You don't have a name for what's happening. You just know you can't get enough. You stop feeding because feeding means you can't breathe. Your lips start to look a little blue at the edges. This is where babies born with HIV in places without treatment usually die, before antiretroviral medicine existed, and in places where it still isn't reaching. Around 20 to 25% of HIV-positive babies don't make it to their first birthday. Most of the time, PCP is what takes them. The lungs simply can't keep up. But let's say someone catches it. Let's say a nurse takes one look at you and orders the right test. The test is a PCR, which looks for the actual virus in your blood, not just antibodies. Because here's a small twist your body plays. For the first several months of life, every baby carries their mother's antibodies. So a standard HIV antibody test will come back positive even if you're not actually infected. That's why doctors need the PCR test for babies. They need to find the virus itself. The test comes back positive. Your mother cries. The doctor starts you on antiretroviral therapy, called ART. This is a combination of usually 3 drugs you'll take every single day in a liquid form first, because you can't swallow pills yet. The medicine doesn't kill the virus. Nothing kills the virus. What it does is stop the virus from copying itself. It freezes the war. Within weeks of starting ART, your blood changes. The amount of virus in you drops, sometimes by 99%. Your CD4 generals start coming back, slowly. Your runny nose finally goes away. You gain weight, you start hitting the milestones you were supposed to hit, you sit up, you crawl, you say your first word. This is the good ending. This is what modern medicine can do. A baby diagnosed early and treated early can grow up to live an almost normal life. Their life expectancy can come within just a few years of someone who was never infected. They can go to school, fall in love, have children of their own who are completely HIV-free, because the medicine works so well that an undetectable virus is an untransmittable virus. But the trade is that the medicine never stops. Not one day, not for the rest of your life. You take it as a toddler, hidden in juice. You take it as a kid, while your mother stands over you to make sure you swallow. You take it as a teenager, which is when it gets hard, because teenagers don't want to take medicine, and they don't want to be different, and they don't always understand that 1 month of skipping pills can let the virus rebuild itself stronger than before. The drugs can also stress your liver, your kidneys, your bones. They can mess with your cholesterol. Your body grows up in a chemical fog that's keeping you alive, but also slowly costing something. There's the other side of it too. You'll have to tell people, or decide not to. You'll have to think about it before kissing someone for the first time, before a school physical, before donating blood, which you can't. Stigma is still real, even now. Plenty of adults still think HIV is something you can catch from a handshake or sharing a cup. It's not, but try telling that to a classmate who heard a rumor. Now, let's go back to the kid who didn't get caught, who didn't get the medicine, because that's still the reality for a lot of babies in parts of the world where testing is rare and drugs are expensive. You make it past PCP somehow. Maybe you got a round of antibiotics that helped, maybe you were just lucky, but the virus is still inside you, multiplying. By age 2 or 3, your immune system is in real trouble. Your CD4 count is below 200, which is the line where doctors say you officially have AIDS. Now the infections come in waves. Thrush keeps coming back. Diarrhea that won't stop. Skin rashes. Swollen lymph nodes in your neck and armpits because your body's drainage system is overwhelmed. Then, your brain. HIV can cross into the brain and cause something called HIV encephalopathy. In a developing child, this is devastating. You stop hitting milestones. You forget words you used to know. You lose strength on one side of your body, your personality changes, your parents watch the child they knew slowly disappear into someone they don't recognize. The virus is eating the wiring before it's even finished being built. By age 5, if you're still alive without treatment, your body is wasting. You're tiny for your age. Your face looks older than it should. You're exhausted all the time. Every cold becomes pneumonia. Every cut takes forever to heal. Your body has run out of ways to defend itself. And here is the hardest part of writing about a child born with HIV. None of this is the child's fault. Not one single piece of it. The kid in the hospital bed didn't choose any of this. They were born into a body that was already at war, in a world that didn't catch it in time. The whole story is a series of failures by adults, governments, healthcare systems, sometimes just bad luck and bad timing. So here's where we land. Being born with HIV today, in a country with good medical care, looks almost nothing like being born with HIV 30 years ago. 30 years ago, it was a death sentence before kindergarten. Today, with a positive test and same-day treatment, it's a chronic condition. Something you manage. Something most people you meet will never even know about. The mother-to-child transmission rate with proper care during pregnancy and after is now less than 1%. 1. That means more than 99 out of 100 babies born to HIV-positive mothers on treatment will be completely HIV negative. We have the tools. We have the medicine. The babies who still die from this, and there are around 130,000 born with HIV every year worldwide, mostly die because the medicine didn't reach them, or it reached them too late. If you take anything from this video, take this. HIV is no longer a question of biology. It's a question of access. The virus hasn't gotten kinder. The science has just gotten faster. And for any baby born today with HIV, the difference between a full life and a short one comes down to one thing. Did the test get done, and did the medicine arrive in time? Stay safe out there, and if you're pregnant, get the test. It's free in most places, it takes a few minutes, and it can change the entire shape of someone else's life before they even take their first breath. See you in the next one.